Looking at the prognosis of patients with angina heart disease, if you are looking at the prognosis, you are more of like trying to look at what is the possibility of this patient even recovering from this disease condition, right? And angina heart disease is mostly due to what? The coronary artery is being blocked by deposition of fat, right? Deposition of fat on the walls. So now as the fat is deposited on the wall, it's now reducing the space in which blood is supposed to flow. All right. The prognosis, or let me say, okay, other causes could be that the coronary artery, just like that, it just started constricting, just like that. There was no blockage, there was no anything, there was no fat blockage and all stuff, right? Another thing could be that there is actually a thrombus formation, not fat. Okay, it could be blood clot that is causing it. So for the prognosis is the possibility of the patient recovering from the disease condition and getting back to their normal life. So we are saying that the prognosis is related to the number of diseased vessels and also the degree of what left ventricular dysfunction. Alright. So we are trying to look at, apart from the coronary artery, is another vessel affected? Or in the coronary artery has many branches, right? How many branches are affected is dependent on that. Okay. So that's why they need to actually pick this disease condition early for you to now survive. Okay. So a patient with a single vessel disease and good left ventricular function has an excellent outlook. Okay, and there's a possibility of about 5 years survival is more than 90%. But if you are having what? Multiple vessel damage, not damage, multiple vessel affected, and your left ventricle, which is the part that pumps blood into systemic circulation, is affected, your prognosis is low. All right. So a patient with a severe left ventricular dysfunction and extensive three vessel disease has a poor prognosis. So your chances of surviving for the next 5 years is low, just about what? 30%. All right. So spontaneous symptomatic improvement due to development of collateral arteries is common. Just like that. Like collateral arteries will develop just to bypass the other blood flow. Okay, so I think that's it for the prognosis for patients who have angina heart disease.